I noticed that when I was brushing that I would bleed. So I would bring that up to my dentist, and my dentist would tell me, oh, you're just brushing too hard. Make sure you get a softer toothbrush. So I did that. I followed the instructions that my dentist back then said, and it would continue happening. I had to move from New Jersey. I was relocated with the company that I work with to Georgia, and I established a new relationship with a new dentist. At that time was the first time that I ever had my gums probed. And that's where the sign of gum disease showed. Back then, I was having 7s, 8s. He immediately recommended me to a periodontist who I visited, and immediately they put a plan in place and they said, you have gum disease, and if you want to save your teeth and bone, we need to get in there and clean this, and this is how it's going to take place. And it was the old traditional type surgery where they scale, they cut, they clean, and then they sew you back up, and there's a lot of gum loss in that. I'd like to go for another opinion, and that's how I was then referenced to Dr. Ramirez, and the rest is history. He says, you're probably here because you know that there are new technology and there's new ways of doing things. And I said, yeah, I've heard of that, and I'd like to know a little more about it. And he says, and I do practice that. I've had a lot of success, and I've been practicing LANAP for a while now. The health of my mouth, I think, has probably improved by 100%. We've had some times where we've had to do some touch-up, but it's only touch-up. It's not going in and doing a full surgery as I've had to have multiple times with the old traditional. My mouth feels solid. I mean, my gums feel very, very, very tight. I do very, very good home care. I may have an area that's getting out of control, and I go in there and clean that up. So what I've noticed since doing LANAP, that those flare-ups have been a lot less. For me, it's been more about my health, of my overall mouth. Go straight to LANAP, find your periodontist, like Dr. Ramirez, that you can build a relationship that you trust, and go with your eyes closed, because that is the procedure to have for gum disease.